I'd like to welcome everybody to today's presentation on HIV Awareness and Screening. If you remember, on Tuesday, it was World AIDS Day, so I figured I'd just kind of round it out by adding this review of HIV awareness and screening for the people that have to have biennial HIV training. I am your host, Dr. Dawn-Elise Snipes. In this hour, we're going to review current knowledge, reference HIV awareness and screening. So the CDC had this nice little infographic here. New HIV diagnoses in the U.S. and dependent areas for the most affected subpopulations for 2018. Now, unfortunately, the CDC, with the exception of flu and COVID, seems to have quite a lag on getting their data out. But, 2018 is a whole lot better than 2010. So in 2018, the largest number of new diagnoses were in Black and African American male-to-male sexual contact, followed by Hispanic or Latino male-to-male sexual contact, then white male-to-male sexual contact. So clearly, male-to-male sexual contact is still a very high-risk behavior for contracting HIV and AIDS. The next group was Black or African American women with heterosexual contact, followed by Black and African American men with heterosexual contact, Hispanic women, Latinos with heterosexual contact, and white women with heterosexual contact. So you can see the risk goes down significantly when we get to the heterosexual contact, but it is certainly not zero. And that's important to remember, that people don't want to fool themselves to think if they are not engaging in male-to-male sexual contact that they are at, extraordinarily low risk. They are at lower risk, but it's still something that they need to take seriously. They have a bunch of tests out now. And the last time in Florida, we don't have to do HIV every biennium, so it had been a while since I reviewed some of the progress they'd made in treating HIV and testing for HIV. And now they have two main types of tests that people use: the rapid self-test, the mail-in self-test, and then obviously you have the tests that you can get at the health department or doctor's office. But in terms of self-testing, the rapid self-test can be ordered by the patient, is available at the pharmacy or online, provides quick results, uses an oral swab, not blood, is sometimes covered by insurance and sometimes covered by a health savings account, but not always. The best thing about this for the rapid self-test is you don't have to have a healthcare provider order it, and it doesn't use blood for people who just can't imagine, doing a blood stick on themselves. The mail-in self-test also can be ordered by the patient. It also can be ordered by the healthcare provider, which for insurance coverage, sometimes the healthcare provider has to be the one to provide the order. It's silly, I know. Mail-in self-tests are not available at pharmacies, but can be ordered online. It does not offer quick results because you're, guess what, mailing it in. And it can find HIV sooner after exposure than the rapid self-test. It does use a blood stick instead of the oral swab, so that can be challenging. And just like the other self-test, sometimes it's covered by insurance and sometimes it's covered by the health savings account, but that's not always a guarantee. A lot of health departments provide free HIV testing as well. So if your client does not have the financial ability to pay for a rapid self-test or a mail-in self-test, and their insurance doesn't cover anything else, definitely reach out to the local health department to find out where people can get free HIV testing. An estimated 1.1 million people in the United States have HIV, and approximately 1 in 7, nearly 15%, are unaware of their status. We need to increase awareness. The treatments, studies have shown that people with HIV who get early intervention and are treatment compliant have a similar life expectancy to HIV negative people. And that is really important. We need to drive that home so people are getting tested regularly. From 2014 to 2018, HIV diagnoses decreased 7% among adults and adolescents. So that's good. I mean, we are decreasing the rate at which people are getting the virus, but we still have thousands of people that are getting diagnosed every year. And just like any other disease, one is too many. HIV can be transmitted by sexual contact, sharing needles, mother to baby during pregnancy, birth, or breastfeeding. However, according to the CDC, there is a very low risk of contracting HIV from oral sex. There is a little bit of a caveat that they don't talk about there. You want to make sure you don't have open wounds in your mouth because that would be a potential vector for transmission. But HIV, from the research I read, is actually kind of a weak virus in terms of it dies off pretty quickly. It dies off pretty quickly if it's on a toilet seat. It dies off pretty quickly on surfaces, but it also dies off pretty quickly when it's exposed to some of the chemicals that are in saliva. So it's not foolproof, but there is a much lower risk of contracting HIV from oral sex, according to the CDC. Stages of HIV infection. This is just kind of for knowledge. Seroconversion is the brief illness people may experience soon after they contract HIV. During this time, they are the most infectious. The asymptomatic stage of HIV, so they get that, they kind of feel like they've got the flu most of the time, they get better. And then there's this asymptomatic stage, which can last for years. And it occurs once seroconversion is over and can last, like I said, for years. Symptomatic HIV occurs when the immune system succumbs to the opportunistic infections and cancers. This is when it starts becoming weaker. Late stage HIV occurs when the disease has just ravaged the immune system and the person is susceptible to a bunch of things. So symptomatic to late stage is pretty much just a progression of intensity or severity of the types of infections and diseases that the person may be susceptible to. The main risk factors for most cancers, because a lot of people with HIV, the problem that they have that ends up killing them is often a cancer. Now, right now, flu and COVID and some of those things can also be quite deadly. But cancer is one of those that we hear about very, very commonly. What can people do? If we are counseling people who have HIV, or who are at risk of HIV, or at risk of cancer without HIV, it's important to help them understand that alcohol, smoking, obesity, stress, radiation exposure, exposure to carcinogens, poor nutrition or a diet that's low in antioxidants, omega-3s, and high in inflammatory factors, and persistent inflammation are all risk factors in general for cancer. It's important to recognize this. Now, alcohol, we talked about a few weeks ago, often increases systemic inflammation, and inflammation puts you at risk for a compromised immune system that's susceptible to cancer. Smoking, we talked about how the carcinogens from that can put you at more risk for cancer. And obesity increases inflammation, and it also increases high body fat levels, increase estrogen in the body. And increased estrogen is correlated with certain types of cancer. So any of these things, or all of these things, are modifiable risk factors that people can really take seriously. And if they have HIV, then they know their immune system really needs to focus on fighting that virus. So it's even more important that they consider taking some radical steps to do as much as they can to prevent other issues. In terms of most infections, and this can be bacterial or viral, hand washing is really important. If you get a cut, a scrape, anything like that, clean it out, cover it up. I know I'm bad about not covering my owies because I get them all the time when I'm in the garden, but we really should cover up our, when we get scrapes and things after we clean them out, to allow the body time to knit that tissue back together and form the barrier. Your skin is basically like a huge barrier to viruses and bacteria, so we want to keep it as intact as possible. Avoid touching your eyes, nose, and mouth. Again, this is bacterial as well as viral. You can get bacterial pink eye by touching your eyes and, all kinds of icky stuff. Our hands are dirty. Our hands are nasty. In college, we did this experiment that we took a swab and we swabbed our hands, and we didn't have cell phones back then, but we swabbed the handles of our purses, or for guys, they swabbed the outside of their wallets, and they put them in agar dishes, and just to look and see what would grow and what was there, and we'd look at it under the microscope to see all of the bacteria, and it was really kind of gross, which has gone a long way to helping me stop biting my fingernails, because under your fingernails is a huge reservoir for bacteria. But I digress. Cover your nose and mouth when you sneeze or cough, and encourage other people to do the same thing. Now, we all know now that we're supposed to cover our nose and mouth with the inside of our elbow instead of our hands, because our hands are dirty enough anyway. And if you sneeze on your hands and then you go touch a doorknob, that's bad. You're not usually opening doors with your elbow. I still suggest that people, if they sneeze or cough, even if they do it into their elbow, they still should probably sanitize their hands just to be on the safe. Social distancing from strangers and people who are sick. Now, right now, we're getting used to social distancing anyway, but people who have HIV or cancer have reduced immune systems. So it is even more important that they, unfortunately, view strangers, people whose bacteria they're not used to being around, view those people sort of as vectors. And unfortunately, little children who tend to have very bad hand hygiene are also little petri dishes. So it's important to take precautions, not to avoid them completely, but to take precautions when you're around children and people that you're not used to being around, or people who are sick. Wearing a mask. That is one thing that has come out of COVID that actually may be beneficial, because it is not as strange, it's not strange at all, to see somebody wearing a mask now. So people who do have cancer or who do have HIV hopefully won't feel as odd or stigmatized about wearing a mask during flu season, for example, when people are sick. And I'm not even talking about COVID and things like that. I'm just talking about your regular flu. It's really helpful to practice all of these things that we've been learning since COVID started during flu season to prevent that. Vaccinations are important, helping the immune system. Get vaccinations against HPV, flu, COVID, and shingles particularly, and talk with your doctor about other vaccines that are out there that can help prevent certain things. People with HIV are at a much higher risk of getting shingles than a person who has a normally functioning immune system. Early intervention and treatment, go figure, is also really important for any type of infection that you get. Whereas, somebody with a normal immune system may kind of try to wait it out a little bit or handle it on their own. It's even more important when you've got a compromised immune system or an immune system that needs to be focused on something else to get early intervention and treatment for viruses, bacterial infections, what have you. And it's important for people to talk with their doctors about what that looks like. You know, we don't want them going and running into the doctor every time they cut their finger in the kitchen, but we also don't want them sitting at home with 102 fever for 4 or 5 days if they could have gone and gotten something like Tamiflu to help knock it out. And regularly wipe down frequently touched objects. If you ever watched the show Monk, great show if you're into kind of offbeat detective series things, but he had a thing about touching people and wipes and dirt. So he always had wipes with him. And since all of the stuff with COVID has started, I've actually begun carrying and having wipes much more available. I don't carry them with me, but we have them in the kitchen. We have them in the bathroom. We have them, and I'll go around once a day and I'll wipe down door handles and things and the handles on the cabinets in the kitchen, just to, just for safe, as my son would say. Regularly wiping these things down is important. And also your mobile device. This thing is nasty. If you look at, swab it and then you look at all the bacteria that's on this, it is worse, they found, than, I've never done it myself to compare, but I have read that it's worse than most toilet seats. So, and you're putting that right up to your face all the time. Wipe that sucker down. Not hard. And they actually, I saw an advertisement, because I get up way too early in the morning, on TV today. They have a purse that has one of the windows that you can actually operate your phone through it, so you don't have to take it out all the time and get it as dirty. So I thought that was kind of cool. And I'm sure there's probably something that men would find acceptable to use. The purse is, kind of small, but by achieving and maintaining an undetectable viral load, people with HIV can remain healthy for many years. Undetectable doesn't mean you don't have it. It means that your immune system has it under control. It's got it, quarantined or whatever. Antiretroviral therapy, or ART, is now recommended for all people with HIV, regardless of their CD4 count. It used to be that people wouldn't necessarily be on antiretroviral therapy during certain phases of the disease. Now they're recommending if you've got HIV, you need to be on antiretrovirals. Evidence from 2 studies, Partner 1 and Partner 2, indicate that the likelihood of passing on HIV is linked to the amount of virus in the blood. So not saying that if you have an undetectable viral load that you are safe to have unprotected sex. No, that's definitely not true. But recognizing that if you are in a relationship with a HIV negative partner and you're HIV positive, if your viral load is undetectable, then you are at a much lower risk of transmitting it if something happens, if you accidentally, swap bodily fluids. PEP, or post-exposure prophylaxis, can be started up to 72 hours after exposure to HIV. If you are in a relationship with somebody who is HIV positive and you're HIV negative and that condom breaks, you can go to the doctor and get on post-exposure prophylaxis, and that usually lasts about 28 days. It's not 100% effective, but it is it is very effective, just not 100%. And there are other ways that people can get exposed. Post-exposure prophylaxis is given to, all rape victims. Anyone who might have been exposed to HIV, if they know they have been, or if it's unknown, the person that they interacted with, I don't know their status. It's possible to do this. Post-exposure prophylaxis, or PEP, is not something that's supposed to be used multiple times routinely. It's really important to use that as something of last resort. You really want to make sure that if you're engaging in activities with somebody who is HIV positive, sexual activities, that you are using condoms and taking precautions. Now, PrEP, or pre-exposure prophylaxis, can help prevent HIV from taking hold. Again, not necessarily 100% effective. If you're taking PrEP, then it's important to get tested for HIV every 3 months, which should, underscore the fact that it's not 100%. But it is something to be aware of. PrEP may be appropriate if you've had sex in the past 6 months with a partner with HIV or have recently been diagnosed with an STD, inject drugs and share needles, have had multiple courses of post-exposure prophylaxis, or continue to engage in risky behavior. If you use pre-exposure prophylaxis, you will be advised to get an HIV test every 3 months. Just like other HIV testing or HIV services, they're not always covered by insurance. You can go to preplocator.org to find a place in your area that offers pre-exposure prophylaxis. Preventing HIV transmission to the baby is actually somewhat doable now. If you're treated for HIV early in your pregnancy, or the risk of transmitting HIV to your baby can be 1% or less. Well, that's good. So we can really significantly reduce the chances that even if the mother is HIV positive, that the baby ends up HIV positive. An HIV positive partner should take pre-exposure prophylaxis if the mother is HIV negative. If the mother is HIV positive, taking antiretroviral therapy as prescribed throughout the pregnancy to get and maintain an undetectable viral load is super important. Remember, we said that the risk of transmission is variable based on the viral load. So it's really important when you're, sharing blood with the baby, with the fetus, as well as, during childbirth, that viral load remain as low as possible. And when people get pregnant, a lot of times they're told not to take any drugs. And obviously we don't want to take illicit drugs. And they're taken off of a lot of different types of medications, including psychotropics. But antiretroviral therapy, the benefits have been found to significantly outweigh the risks. Once the baby is born, it will be on antiretroviral therapy for 4 to 6 weeks, just to make sure that it didn't get transmitted to the baby and, it's cleared from their system. It's advised that the mother use formula instead of breast milk because HIV can be transmitted through breast milk. This can be very frustrating for some mothers who wanted to breastfeed. It can also be challenging for the mother-baby bonding because, breastfeeding is when a lot of bonding occurs, but not always. I mean, there have been hundreds of thousands of mothers who have given their baby formula instead of breast milk, and everything's turned out fine. The key here is skin-to-skin contact. It's important for the mother to hold the baby, even if they're not breastfeeding, that holding the baby and nurturing the baby is what's important for stimulating that oxytocin. In preemies, skin-to-skin contact is called kangaroo care, and it is super important for the health and well-being of the infant. When the mother is HIV positive, a cesarean delivery should be considered. They have all kinds of special precautions they take to minimize the baby's exposure to any blood. As behavioral health care providers, we're often not the ones that are doing the testing. If you work in a substance abuse treatment facility, you may have an HIV department, and they do HIV screening and counseling and all that kind of stuff. And that's great. That's awesome. I wish we had that more in different places. But if you are in private practice or a smaller practice, you may not have an HIV department, and they may not be doing the testing. That's fine. It is important, though, since 1 in 7 people don't know they have it, that we should make sure that we are screening people for high-risk behaviors. The people who need to be screened and preferably tested at least once, and some people annually, include people who have HIV, AIDS, and their sex partners. If they have the disease, it's important to get tested regularly to monitor their CD4 count. And their sex partners do need to be tested regularly, obviously, to make sure that there is no transmission. Sexually active men who have sex with men need to be screened more frequently than other groups. As you saw in the infographic at the beginning, men who have sex with men are at a much higher risk of contracting the disease than other groups. People who themselves or their sex partners have had more than one sex partner since their most recent HIV test should also get retested. And that's, important to recognize. If people are they're married or they're in a monogamous relationship and one partner cheats, that could be a problem. If they are in an open relationship and where it's not considered cheating, that people are consensually dating other people, they're not in a monogamous relationship, then getting screened at least annually can also be important. People receiving treatment for hepatitis, tuberculosis, or a sexually transmitted disease also need to be tested at least annually. And I thought that was kind of interesting, that there's a high correlation between hepatitis, TB, and STDs and HIV. So if you're being treated for one of those, then you should also be screened for HIV. It is vital, in my humble opinion, that care is used when screening to identify people who may be at risk of HIV to avoid stigmatizing. One of the groups of people who should be screened regularly, according to the CDC, are, quote, people who trade sex for drugs. Now, people who trade sex for drugs would fall under being a person who has had more than one sex partner since their most recent HIV test. So it's really sort of, in my opinion, stigmatizing and pathologizing to have this extra category here. It sounds like you're blaming the person for what happened. Yes, they are going to have more sex partners than one since their last HIV test, so they need to get tested. People who share needles. Well, there's a lot of ways that needle sticks, needle sticks in the hospital, needle sticks in an ambulance, needle sticks if you have somebody who is living in your household who has diabetes and HIV, they have to give themselves insulin shots. They don't dispose of their sharp appropriately, and somebody else gets stuck. So it's important to recognize our verbiage so it doesn't sound like we are stigmatizing or blaming people or trying to shame them in some way. And the term multiple sex partners, I don't like that one either. You have people who are in polyamorous relationships, people who are consensually non-monogamous, people who ascribe to a philosophy called relationship anarchy. There are a lot of different terms for it, but it's important in my mind that we are compassionate towards people and avoid using terms that they may find offensive or shaming in some way, as if you're trying to say that there's something wrong with having multiple sex partners. So what can we do? We're not going to be doing the test ourselves. We need to screen to see if somebody needs to be referred for a test. Signs and symptoms commonly seen in early stages of HIV include fever and chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and ulcers in the mouth. Now, a lot of these sound like a bad cold, sound like the flu, or sound like tuberculosis. In any of those cases, it can't hurt to get screened by a doctor. So we do want to screen for those. We also obviously want to, when we're doing our preliminary screening, ask questions to find out if somebody is engaging in higher risk behaviors. Infected individuals can have the virus for up to 10 years and sometimes longer without showing signs or symptoms. And it's important for us to remember that just because we're dealing with somebody who's not even showing any of these early signs and symptoms, it's still important, if they've had multiple sex partners since their last HIV test, for them to consider getting tested. It isn't going to be something that hurts, except for the needle stick, but it's certainly something that is beneficial if they do find out that they're HIV positive, so they can get the treatment that they need. Types of tests. Nucleic acid tests identifies the virus in the blood 10 to 33 days post-exposure. Antigen or antibody tests look for evidence of exposure, look for the antibodies, and antigens, or certain parts of signs that the virus is there, which are produced before antibodies are developed. The antigen-antibody tests can detect HIV in the system 18 to 45 days post-exposure. Antibody tests alone, not antigen-antibody, but just simply antibody tests, look for antibodies in the blood or the saliva 23 to 90 days after exposure. Now, your self-tests are often the antibody-only tests, so they're not going to show exposure until, at least 3 weeks after the exposure. I'm sorry, they're not going to show infection, if it exists, until at least 3 weeks after the exposure. The oral fluid antibody test provides results within 20 minutes. This is the one that you can order for yourself. You can order it, it's sent to your home. You do it in home. It's just kind of like a pregnancy test, except for with saliva. Really easy to do. The rapid antibody screening test is usually done with blood from the finger prick, and results are often ready within 30 minutes if it's done in a doctor's office. The rapid antibody screening test is also the one that can be sent off, which, snail mail slows down the process of getting that done. Oops. Negative results do not necessarily mean you don't have HIV, because there's that window there where, we say, go back here, 10 to 33 days. So if you take it on the 11th day, it may be a negative, but if you take it on the 33rd day, it may be positive. So there is a window there that you need to be aware of and potentially be retested. Another reason for false negatives can be from user error on in-home tests. Somehow you don't get enough saliva, enough blood, you don't wait long enough. There are a variety of different ways that the test can be corrupted. Negative results only mean that you are negative and don't reflect your partner's status, even if you've engaged in high-risk behaviors with that person. So if you're trying to take a test to see if your partner's positive because you assume that if you're negative, then they're going to be negative, and and if they're positive, then you'll be positive. That's faulty logic, okay? So it's important for every person to get an HIV test for themselves. Positive results. There can be false positives too, and it's important people understand this. Positive results need to be confirmed by a second test. Even if the first test was done at the doctor's office, they'll usually send you for a second, more stringent HIV test. So people need to take positive results seriously, but also get it retested, not start spinning out of control as soon as they get those results. It's important to have a confirmatory test after a positive test. Vaccines. Oh my gosh, I was so excited to find out about how much progress had been made in the vaccines. And since COVID, this is, another benefit of COVID, if you will, we have learned more and we understand more about phase 1, phase 2, phase 3 trials. Johnson & Johnson has an HIV vaccine that is in late stages of phase 3 clinical trials. So they're wrapping it up, which is really awesome, which means a HIV vaccine could be on the market soon. You can find out about more vaccines that are available. You can see all these little doo-wops here. The International AIDS Vaccine Initiative, or IAVI, keeps a list of the current vaccines that are in the research pipeline. And this is actually from avac.org from February of 2020. But it shows that 28 vaccines are in preclinical stages. 16 are in phase 1, phase 2, and 2, one of them being the Johnson & Johnson vaccine, are in phase 3 right now. So it is really exciting to think about the fact that we could have a vaccine for this in short order. And my hope is, and this is completely not research-based, my hope is that we have learned so much through this COVID fiasco that vaccine discovery will become more of a priority and people will be more comfortable, or pharmaceutical companies will be more comfortable trying to develop vaccines. So more vaccines for things like HIV and cancer hopefully will be coming to the forefront sooner rather than later. Many advances have been made in improving testing accessibility, prevention medications, and antiretroviral therapies. Remember on Tuesday, when we were talking about the needs of people with HIV, we were talking about how the old antiretrovirals had a whole bunch of really nasty side effects, including muscle pain, headache, kidney stones, lots of bad stuff. And the newer generation antiretrovirals are much less problematic in terms of side effects. So that is excellent. The newer antiretrovirals are much safer for babies when, or fetuses when the mother is pregnant. And because there are many, many fewer side effects to the antiretrovirals, people tend to be more treatment compliant. If you think back to things like tuberculosis, people would take the medication for the tuberculosis, but they wouldn't finish it. So then they would end up developing antibiotic-resistant strains of tuberculosis. Same thing with other bacteria. If you don't completely wipe it out, then the little buggas that remain are the ones that were strong enough to withstand that antibiotic. So it's really important to make sure that you are treatment compliant with antiretrovirals as well as antibiotics to prevent developing strains of the virus or strains of a bacteria which are require different types of treatment, which are resistant to treatment. So the newer antiretrovirals, since they have lower side effects, treatment compliance is much, much higher. And that's a great thing, because not only does that prevent us from developing treatment-resistant strains of the virus, it also helps extend not only the length, but the quality of the life of a person with HIV. The sooner somebody is diagnosed, the better their long-term prognosis. If they get diagnosed right after they're exposed, then they have a much better prognosis than someone who doesn't get diagnosed until they are in the early symptomatic stage. The longer the virus stays in your body, the more havoc it wreaks on your immune system. So getting treatment early can help that immune system stay healthy and help the person stay healthier. Screening can be, and really kind of should be, a routine part of clinical intakes in behavioral health settings. And I know I've said that with a bunch of things, from diabetes to cancer to now HIV. And yes, there is a lot of stuff, but it's really not that hard to create a one-sheet check sheet where people can check off symptoms that they've had in the past, 3 to 6 months, in order to identify anybody who might need to be referred to a health department or to a medical professional for further screening for physiological conditions. Because with any of those things I mentioned, the earlier it's identified and treatment is begun, the better the prognosis. So we are getting finished a little bit early today. Do you have questions about HIV screening, HIV awareness? If this podcast helps you help your clients or yourself, please support us by purchasing your CEUs at AllCEUs.com or getting your agency to sponsor an episode. A direct link to the on-demand CEUs for this podcast is at allceus.com/podcastceus. That's allceus.com/podcastceus. To sponsor an episode of Counselor Toolbox and reach over 50,000 clinicians per week, go to allceus.com/sponsor. Thank you.